Welcome back, all. Let's continue the insightful talk by Professor Dr. G. Gopakumar on the topic Administrative Response to a New Normal Society Issues and Potentialities in the Indian Context. Over to you, sir.
So we brought in that department. There was some challenge regarding recruitment of faculty because it included not only science but also social science. So now there is a public health and community development department in the Central University of Kerala. Our goal, or the university's goal, is to train as many number of public health professionals for the country. This is what I am telling at the larger level, because we need in India public health professionals. Actually, government expenditure on public health is very, very small. Can you imagine that 3 years ago, public health expenditure from public spending was just 1.1%. Today, it is just 1.4%. This is nothing. We need at least 2.5% of the GDP in public expenditure. Otherwise, where are the resources for achieving these things? So this is a very important thing. And more money is required, because otherwise we will continue to be influenced by the market-driven policies of private sector. I won't say that private sector should be avoided. We need a public-private partnership. That's the best solution. But we cannot be just dictated by market-driven conditions. As you know very well, how much an RT-PCR test cost until the government interfered. They were looting. And once the government interfered, the cost of public sector came down. So that is how we know that the cost of RT-PCR testing came down. So this is how we should intervene. So GDP for public expenditure should be minimum 2.5% to 3%. Now these two things, education and health, are very, very important. And thankfully, the new education policy provide more space for and funding for education. But for health, I think the pandemic has given us an opportunity, not just a challenge. We should allocate more resources under public expenditure for health infrastructure. Now I move on to my fourth point, education. All of us sitting here, we are part of this educational system. Let me again start with a small experience. When pandemic occurred, we had no clue as to how to start. Initially, we followed what the state government suggested. We closed our campus. Particularly, the students were permitted to go home. Hostels were closed. Classes were suspended. But then came a big issue. What will you do with the cottages? Because many people are staying in the cottage. Staff are staying in the cottage. Our medical doctor, physician, suggested that there is a possibility of a community spread. Why don't you close the cottage also? And keep the whole campus completely closed. So I did not agree with that. I said, suppose we close the quarters, housing, where will these people go? They cannot move from this district, and they belong to different districts and different states, and they won't be able to move up. So you cannot ignore them. So we must protect them. So I did not agree for closing the quarters or housing, but hostels were closed, classes were suspended, and the whole educational scenario in the country came to a grinding halt. Of course, the whole world, this was true. We need to ensure we have better life skills for work and life. In the entire world, nearly 2 billion students were affected. In India, at least in Kerala, I can tell you, lakhs and lakhs of students were affected. And even at the national level, at least 3 crores of students were affected by this. Instead, we started with online learning. That became another problem because we need digital upskilling. Know that we were not trained, ordinary students were not trained. Some states provided free cell phones, but even with cell phone, you need training. And at the national level, internet penetration had its problems, and digital upskilling is required. Wi-Fi has to be expanded. Of course, the government of India ensured earlier, even before the pandemic, that every campus should have Wi-Fi. I would say that now the situation has come to a level that Wi-Fi has to be the whole umbrella for India. Entire India has to be covered by Wi-Fi. So we need to develop new learning methods. Teachers are to be upskilled, to be skilled, because even taking classes, these are very, very important. We face some problems like, how to organize the results, because the dissertations can be sent by online, but you cannot conduct what is called the laboratory test. The science students do have practicals, but how to conduct practical over virtually? You can have a viva voce virtually, but how to conduct practicals, science practicals? So we had limitation. Instead of that, what we did was the science teachers were asked to show the students some instruments, scientific instruments, and ask the students to identify them. This was considered to be part of the practical. But these are all limitations. So campus closing, substitution by online learning, all these things, digital learning is important. It's very good. But globally and nationally, it becomes very difficult because internet connectivity is poor. Even in hilly areas of Kerala, internet connectivity is not there. So how can you expect internet connectivity to take place at the national level? The quality of education, the content of education became a big problem. Curriculum has to be revised. Pedagogy has to be changed. Digital enabling becomes important. New learning methods are vital. Teachers and students have to be trained in these levels. These things are easily said than done. So education next to healthcare, I think, comes very, very important. And we need to continuously concentrate. Of course, online education as well, but life skills are important for both work and life. I move on to my fifth point, national safety and security. Well, we are facing such a situation with lockdown and border restriction and increase of crime. Naturally, during the pandemic period, there was increase of crime. There was domestic violence, increase of domestic violence, increase of theft and looting, cyber crime, digital insecurity issue, and immigrants, interstate immigrants, their movement, all these became problems. Even at the national level, you can say that there are illegal immigrants moving from Bangladesh border to India, even from some other northeastern states like Myanmar to India. So when we face such problems, particularly during the pandemic period, this also raises a fundamental question of national safety and security. So increase of crime, domestic violence, digital insecurity, cyber crime, illegal immigration, all these things become very crucial, and state has to intervene and ensure that interstate security is assured. Our borders are to be made safer at this level. So the state has a responsibility not only at the borders but also at the interstate borders also, and even at the regions also. We need a lot of concentration and supervision and monitoring. I move on to my next point quickly, the issue of climate change. Now this has become very, very topical. We do have extreme weather conditions and all our parameters about climate, and the climate clock has changed. Kerala particularly suffered during the last 5-6 years. If you just count virus, Nipah, 2 floods, and the pandemic, together it destroyed around 5 to 6 years of our life. So at the national level, you have extreme weather conditions, weather-related events, floods, heat waves, fire, forest fire, So environmental management becomes very, very important, very crucial. Environmental supervision becomes very important. Earlier, UNESCO, United Nations helped us and directed all the developing countries and developed countries to ensure sustainable development. Recently there was COP26, and during the conference of parties, all countries had to address this question of climate change. The positive side for the developed countries is that they had overcome, because they had already had their industrial revolution. Manufacturing is also done to a greater level. So they can prescribe environmental rules and mandate to the developing countries. But for our growth engine is depend upon manufacturing, construction, and naturally this will affect climatic conditions. And moreover, our population is so huge. So developing countries were insisted to put a moratorium to our carbon emission. And as our Prime Minister suggested and committed, that we will be able to reduce our carbon emission to below 2% by 2070. I think it's a sincere claim because there is no point in making false claims and not achieving that. So you cannot stop carbon emission, but you have to reduce substantially. But we will be able to bring down to the optimal level by 2070. And we hopefully should change to that situation and ensure that the market-driven economy doesn't destroy our environment. And this is something very important. Pandemic has given us a lot of lessons, because climatic changes also is an impact, and the climatic changes increases the intensity of pandemic. So this is very vital, and we need to manage our disaster. So disaster management, a sustainable ecosystem has to be developed. And a sustainable ecosystem requires proper balancing from several levels: public, private, civil society, the state, etc. And all these levels, the management becomes important. We know very well in Kerala, we failed even in achieving proper waste management. We are a small state, such a small state with huge population, and also hungry for infrastructural development. No doubts our roads are to be improved. But imagining that, or considering that sometimes our priority becomes different, we are planning for having a 5th international airport in Sabarimala. So some of our lopsided priorities are destroying our environmental management as well. So we have to be very sure that a sustainable environmental development is required, not a rapid expansion, which will affect every section of the society, and more particularly for a small state like Kerala. I come to my last point on this, trust in government. As students of public administration, we know that governments are to be transparent and interconnected, and a holistic approach of governmental management and government to government relationship, government to business relationship, government to NGOs, so that the role of government and local governments and non-state governments are taken up very significantly. Our local governments are to be strengthened and energized. State and local governments are very vital and important for addressing pandemic. We have to prioritize our solutions, promote equality, and balance our long-term interests and immediate interests, because we cannot jump for long-term interests suddenly, but we can start. But urgent interests, urgent needs are important. And how to go ahead with the urgent needs, how to take up such issues by ensuring transparency, and also managing a situation wherein we assure that the government is available for the people and the government can help in the protecting the people, in securing the people, and ensuring that the transparency of the government will ensure more confidence for the people to progress further. So ultimately, government's task is multifold now. I'm not saying that a bureaucratic system, I'm not saying a big government, but a functional government, a government from national, state, local level, at the micro level, and train the government officials in such a way that they are becoming warriors, not only health warriors, but government itself become real soldiers to address the pandemic. So conventional bureaucratic life is not recommended. See, we used to say that sarkari karyam murabole. No, that is not possible. That is by what we say rule bound. It is not rule bound. It had to be development oriented. And that is where conventional development administration, new public management, etc., must have trained and taught you a lot about how administration has to become extremely dynamic in this present situation. So pandemic demanded that the administration should become dynamic, grassroots oriented, instead of sitting in air-conditioned rooms or with a centralized character. No, that is not at all suggested. So let us come to the suggestions part. I am going to conclude my presentation. I have identified around 10 points as my focused conclusions or suggestions in this level. There can be more which are vital for a developing economy and a developing administration. Number one, dynamic, committed, and well-coordinated public administration. A dynamic, committed, and well-coordinated public administration is required. Our pandemic has shown us that we were not coordinated properly. So we need to be coordinated, well-coordinated, with interdepartmental coordination, interdisciplinary coordination. It has to be dynamic, it has to be committed, and it has to be properly coordinated. This cannot be achieved but for creating a very good leadership at the horizontal level, at the national level, state level, and local levels. So we need to progress and create a kind of a functioning bureaucracy with an excellent leadership at three levels: local level, state level, and national level. We know at the local level there are scope for village leadership, scope for block or taluk leadership, and district leadership. Then you have at the state level leadership, and then you need to have national level leadership. Now, our pandemic experiences are before us. How could Delhi was able to address this pandemic? I think leadership is very crucial. Of course, Kerala also addressed successfully COVID management in the initial phase. But beyond that, at some point we had problems, and it still remains a mystery why it continues in Kerala. Delhi is a huge state with nearly 3.5 crores of people, 35 million people, more than Kerala's population, and highly floating population. So highly floating population, that means people can come and go. So pandemic spread and community spread is very possible. So how Delhi government was able to address this very successfully. Initially, Maharashtra also suffered a lot. A place like Dharavi in Mumbai. Dharavi in Mumbai was all set for a community spread. But luckily, we saved ourselves despite the huge loss of men, huge loss of people. But Dharavi was able to address this issue. So some of the states that became vulnerable included Bihar, Madhya Pradesh, Maharashtra certainly, and Delhi. So this, and towards the south, of course, Karnataka was affected, Andhra was affected, Kerala was affected, Punjab in the north was affected. So leadership is very, very important. Today we have television, we have social media. So any kind of governmental coordination is possible through these media. You can use such media and reach to the people so that administration can coordinate in a dynamic fashion addressing the challenge of pandemic. Number one. Number two, more financial commitment and funding is required. More financial commitment and funding is required. Right to health is a fundamental right under Article 21. Thanks to the intervention of Supreme Court, right to life has been expanded, including compulsory right to education. So our right to health is fundamental. It is compulsory. The duty of the state to protect its people. So how can it be protected? And that is where infrastructure, training, leadership, manpower, etc. are vital. So this can be done only when you have a vision, you have a mission, and you have an organization. So health infrastructure has to become more radical, and that is where we should increase our GDP to 2.5% to 3% for healthcare through public spending. Let the private sector thrive on its own. If the middle class who can afford it, let them go. But the larger section of the people, including the lower middle class and the marginalized classes, depend hugely on the state sector. So we would suggest 2.5% to 3% of GDP share for healthcare through public spending. And such a financial support and funding would revitalize and revolutionize the health infrastructure in this country. Number three, strengthen the healthcare facilities in rural India. Strengthen the healthcare facilities in rural India. And now, unfortunately, I must say that it is more urban centric. Our healthcare is more urban centered. I don't know why government insists that All India Institute of Medical Sciences aims should come only in cities. It should come everywhere. While I was Vice Chancellor, I was advocating, I was constantly contacting Government of India that the public demand in the civil society for starting a medical college in Kasaragod under the Central University. I mobilized the civil society for that. We submitted so many representations. Even the Executive Council of the Central University of Kerala passed a resolution and allocated 50 acres of land for starting a medical college. Now I'm just suggesting that under public spending, medical colleges can be started. Aims should come into the villages also. Why it should be central only in those places you have urban centered? That is why I am critical of this. Our healthcare is now urban centric. Instead, healthcare professionals must concentrate on rural areas. Healthcare professionals must concentrate on rural areas. It has to be made a policy and mandatory for doctors, nurses, and other health staff and para-health staff to serve in the rural areas. It has to be made compulsory. It has to be made mandatory. So make it a policy for doctors, nurses, and other staff in the health department so that healthcare in rural areas will improve. We have to uphold the values of public health in improvising sustainable development and progress. Otherwise, only the middle class will be benefited. So if you want to progress and ensure equity in healthcare, rural healthcare is very, very vital. I don't say that there are no missions. I am sensitive about National Rural Health Mission and similar other projects. But these are not sufficient. We need more hospitals, more healthcare facilities, more healthcare professionals to serve in the rural areas. Number 4, give more scope for state and local governments in tackling the issues of new normal. So, public health is a state agenda under the concurrent list, under the Schedule 7, public health is under the state list. So let us give more scope for state and local governments in tackling the issues of new normal. Over-centralization is not at all feasible. And let the local governments and state governments are given more powers, more funding, more resources, more initiative. That will create new generation of leadership for strengthening rural health care. So decentralization of health care, particularly at the local level and state level. Number 5, we must protect the unorganized sector, because under the pandemic, the worst suffered were the unorganized sector. We are aware of the poor interstate migrants. We should protect them. Some states took initiative like free rationing. Even in Kerala, you had the kits supplied during that season. Tamil Nadu gave complete free ration to all the people. So why don't we develop a proper data system and data management so that we can understand who are the unorganized sector, who are the poor migrants, and let them be beneficiaries of the public distribution system. Let them also get other support system like hospitals. Let them, with a card, they can access the hospitals. They will get some access to shelter. They should get some money also, pocket expenses. Otherwise, the scenario that we saw during the pandemic, millions of workers moving from southern states to western states and northern states. Imagine people traveling from Kerala to Uttarakhand or to deep villages of Maharashtra or to the northeast. Now you cannot encourage to happen this again. And that is where the unorganized sector are to be properly monitored, encouraged to join the list of beneficiaries in the public distribution system. Ours is a welfare state, but we are not aware of who are the people who deserve welfare. This is our problem. Proper data are required so that those who deserve must be given proper support in the form of public distribution system, hospitals, shelter, and financial support, etc. This is very important for a welfare state. Number 6, strengthen digital connectivity and promote online education substantially. So we need to strengthen our digital connectivity and promote online education. Although online education is still running, I can give you evidences where the poor people who do not have access to online education, they were even when offline education has started, they were assured that you can go either to school or to go follow online education. They may not be accepting both. They may not be doing both. They may be wandering around instead of going to the school because number of students coming to the school are restricted, and also online education facilities are also limited. So this can be overcome only when we strengthen our digital connectivity, promote online education, train teachers and students, provide proper infrastructure and exposure. These are very, very vital. Number 7, data management is crucial. Data management is crucial in regard to patients, relatives, and children. We need proper data accounting, and proper data accounting is possible. And we need to collect proper information about patients, their relatives, their children. And these things are going to be very, very vital. And I think with the help of ICT, information communication and technology, revised surveys can be done. More and more surveys can be done. I'm not saying about sample surveys. I'm speaking about physical counting. Now with connectivity and digital connectivity, these things are possible. Number 8, equity in vaccination is very essential. Equity in vaccination. Some people refuse to take vaccination. In some places, vaccination is not available. So equity in vaccination is important. On the positive side, we can say that India is already a pharmaceutical power. India is a pharmaceutical power for the world. We produce we have become the pharmacy headquarters of the world. We produce medicines, we manufacture medicines, we manufacture vaccines, but we are yet to ensure vaccinations to all the people. Even now, 100% of single vaccination is not achieved. So let us continue our effort, and equity in vaccination, encouraging people who refuses to take vaccination, volunteerism, etc. is required. Vaccine equity, this is a very important social theme for public administration students. Vaccine equity is very vital. Number 9, community participation to be encouraged. And here there are 3 units for community participation. Number 1, local governments. Number 2, NGOs. Number 3, civil society organizations. So, local governments, non-governmental organizations, civil society organizations, they can play a vital role in community participation, and challenging the pandemic is through community participation and citizen participation. We can use local governments, NGOs, and civil society, and we can ensure that our civil society will be made more vibrant and healthy. As of now, it is not very healthy. It is not very vibrant except in urban areas. We need a strong, vibrant civil society. And finally, the role of media and social media. A responsible media, proper accounting is important, and social media for effective and transparent reporting. So media has to become very, very responsible and accountable. Social media has to be also made more accountable, because otherwise social media leads to some kind of anarchy and unsocial nature. Instead of that, what we require is a proper, responsible social media, an accountable social media, and print media and electronic media, and certainly internet can also be a great source for this effective transparency. So I conclude here on this presentation on the theme of administrative response to new normal societies. I have identified issues, but in the process I have also identified the scope and potentialities in this current context. I do hope that there will be some questions following this discussion, and I thank Dr. Ajita for giving me this good opportunity. And I wish you all the success, and in the years to come, let us hope our India will become a very vibrant, healthy society. We often speak about a demographic dividend, because more than 52% of India's population are below 26 years of age. Good. But unless you make the healthy young people, unless you ensure that the young people are educated, healthy, and see that they are having nutritious food, it will be, if we lack in all these things, demographic dividend will become a demographic disaster. In order to avoid that, we must challenge malnutrition. We must ensure nutritious food, ensure healthy food, and also healthcare, a proper healthcare and proper education, so that the demographic dividend can be properly augmented. I wish you all success, and thank you very much.